Treatment and management of irritable bowel syndrome, as it is disorder of the bowel movements and motility, and it is associated with alternate diarrhea and constipation episodes. So the treatment is according to the symptoms which are appearing. If there is diarrhea, anti-diarrheal treatment is provided, especially the loperamide compound capsules they are given. If there is constipation, then very laxative, especially the magnesium and the aluminum hydroxide compounds, they are used for alleviation of the constipation. The abdominal pain is relieved by antispasmodic drugs. For that, myosin compound, injection of nospa, tramadol, diclorian injections, they are given to relieve the pain of the patient. The pain is relieved only temporarily, as this disorder is lifelong one with normal pauses and alternate diarrhea and constipation. So medicine they are used according to the symptom appearing in the patient. So we have to adjust the life of the patient more suitable by the various steps, management and the use of the drugs. There is no use of or benefit of antibiotic therapy, PPI, I mean proton, I mean the various omeprazole, isomeprazole, and the various similar drugs. They are not useful for the treatment of this disorder. I mean the PPI drugs should not be used. Antibiotics should be avoided. Now, the deficiency of the vitamin D, which is said to be responsible also for creation of this disorder, that can be overcome by the capsules of the vitamin D or the injection of vitamin D can be given to the patient. Moreover, peppermint oil capsules they are also used for the benefit of the patient in this disease. The food stuff which are containing fructose, lactose, gluten should be avoided and excluded from the diet of the patient, because these produces flatulence due to fermentation by the bacteria of the small intestine. Now fiber diet is very useful for the patient, especially the soluble fibers. They must be used in various foodstuffs, especially the nuts and the various vegetables and fresh fruits. The fruit should be eaten as a whole with the peel, or the skin of the fruit must be taken entirely. Exercise is compulsory. Daily routine aerobic exercise is necessary for the healthy weight of the body and to maintain the sufficient circulation and the blood supply and oxygen supply to the gastrointestinal tract tissues. So these are the various steps by which we can reduce the symptoms of the syndrome by taking the steps, and moreover, we have to avoid the triggering factors or the risk factors, especially the stress, depression, anxiety factors. These are avoided by the management, by the meditation and the yoga exercises and the various hobbies and activities advised to the patient that he should avoid these psychiatric complications which are responsible as a trigger factor for the visceral hypersensitivity of the mucosa of the gastrointestinal tract, which are responsible for production of abnormal or the disorder of the bowel movements, responsible for this irritable disease.